Hello and welcome to Infocus. I'm Bradley Valenaki. The St. John ambulance staff have been with many other health workers in Papua New Guinea on the front line responding to COVID-19 needs throughout Papua New Guinea. And we take a look back on how far the journey has been for the organization here in Papua New Guinea. And I'm privileged to have with me in the studio the CEO of St. John Ambulance, Matt Cannon. Matt, welcome to the show.
Thank you for having me on the show.
All right, so Matt, the response so far, it's been a hard year. So last year, 2020, 2021, almost to the end. Tell us about the response so far.
Well, COVID's come in waves, hasn't it? It's come in this first wave that we saw in the beginning in 2020. And then we had another wave in August, and we had another wave in April this year. But now we're faced with this Delta strain, which is much more virulent and much more contagious. And we're seeing more people present to hospital. And sadly, we're seeing more people pass away from the COVID disease.
All right. So has that sort of changed the focus in which services from the ambulance has been delivered thus far?
Typically, the ambulance service before COVID would respond to a lot of cases involving maternity, mothers in labor. We would respond to respiratory conditions, cardiac. But now we're seeing that the ambulance service is kept busy with these COVID cases during the surges. So right now we're seeing around 40 to 70% of our cases are COVID related. The last couple of days, we've seen 4 times as many calls for ambulance assistance as we would in other times.
So typically, in 10 people, you would see 7 patients who are COVID positive.
We're seeing it come in fluctuations, so around 4 to 7 out of every 10 patients that we're attending at the moment are COVID related. But you've got to put that in the perspective that we're seeing about a 4-fold increase in people needing ambulances every day at the moment.
So it must also be a concern for the organization now with the increase in COVID-19 cases, especially for your staff.
Definitely. It's putting an extra burden on us at the moment, but it's something that we must respond to bring care to our patients. What we are having to do is get extra ambulances, more ambulances, because what happens when we transport a patient with COVID is we have to decontaminate the ambulance, and that can take about a 1-hour process of cleaning the roof of the ambulance, cleaning the walls, cleaning everywhere that the patient has been, and making sure that ambulance is as clean as possible, decontaminated, so that if the next patient we respond to is for some other condition like a mother in labor, that we've reduced all risk of transmission as much as possible for the virus.
So for these calls that you've been getting through your call center, those that are turning up are mostly COVID patients. But are you seeing the other cases as well also rise?
We're still being called to all sorts of emergencies across NCD, in Ley, in Kokopo, in Kundiawa, in Central Province. We're still getting the normal calls. We are still getting the trauma that we're being called to, the cases of violence, the labor cases. These are still happening, but we're seeing a significant spike. So it's important that we can get more ambulances on road immediately, that we can get more ambulances in the rural stations that we operate, so we can get to more patients and bring them from the rural health centres to the provincial hospitals.
All right, you spoke of the disinfection exercise undertaken by St. John. I understand the other general admissions would also require disinfecting the vehicles for use, but this specifically to the new disease, a new virus, it has to be done. Is it costly for the organization?
It's costly in the sense it requires a lot of resources. So we have 2 or 3 staff on duty 24 hours a day, and their job is to make sure that the ambulances are fully cleaned, decontaminated between patients. And that's an extensive process. We need to use cleaning chemicals. We need to use PPEs when we're doing that. So the people cleaning the ambulance, there's a risk if they're not in PPE that they could get COVID from the surfaces, what we call formites, where the disease is on surfaces, or it might be in the air in the ambulance. So it's important that they were fully protected in the category 2 PPE, which includes face masks, goggles, gloves, and a gown, and that they're sterilizing all of the equipment and the ambulance. And it takes a bit longer as well, because what we tend to do, once we've finished the case, we'll tend to leave the ambulance doors all wide open, which allows the fresh air to come in to remove the virus from the environment in the air. And then it's a process of cleaning. It's a delicate process of cleaning all of the surfaces and all of the equipment that's come in contact with the patient with the time that we're seeing them. And that can take quite a while, because sometimes we've got the cardiac monitors, we've got the pulse oximeter monitors, we've got the blood pressure, we've got medical kits that we might have opened to provide treatment if we needed to put a drip with IV fluids in the patient, or we've needed to give them oxygen. Then we need to decontaminate the whole vehicle. And it can take about an hour or 2 hours sometimes to do that. And we can't use the ambulance until it's decontaminated, because it wouldn't be acceptable to potentially pass that virus onto another patient or another staff member. And that's why it's so important that we are decontaminating these ambulances between patients.
All right. Interesting discussions there. We'll take a short break and come back on the other side with more. Discussions on Infocus of the work St. John Ambulance is doing during the COVID-19 pandemic. Now, Matt, before the break, we spoke about the responsibilities of St. John Ambulance in its general work in responding to cases. But the government has also tasked St. John Ambulance to look after the Tarahumara Aquatics Center with also help from those at the Port Moresby General Hospital. How has it been?
The Tarahumara Aquatic Centre is an extension. It's a ward of the Port Moresby General Hospital, and you're quite right that the government's asked St. John to be involved in that process. We're proud that at TAC we're handling the mild and the moderate patients, and the medical care of patients at the Aquatic Centre is managed by the Port Moresby General Hospital. Dr. Mangu Kendino is in charge there and works alongside Dr. Moke, who's the clinical coordinator for COVID-19 at the Port Moresby General Hospital. The Tarahumara Aquatic Centre is an overflow facility, so it's designed to ease the burden on POMGen so that POMGen can focus on treating the serious patients and the ones that need high acuity clinical treatments at the General Hospital, and the Aquatic Centre is able to manage the mild and moderate cases. What St. John's role is we're providing a base level of nursing staff, providing some emergency medical support if patients suddenly deteriorate. We've got a doctor, we've got doctors and nurses and HEOs on hand to manage the immediate stabilization of that patient. We also are providing the psychosocial support. So it's important that these patients have counseling if they need it, that we can provide them with some flex credits so they can stay in contact with their loved ones. Hydration and food is very important when someone is recovering with COVID-19. So we're making sure that there's adequate hydration and plenty of food available for them, healthy foods, vegetables, garden foods, and protein as well, chicken, fish, this kind of thing. And also we're looking after the hygiene and the medical equipment. So it's essentially we're running the facility, and the General Hospital, Port Moresby General Hospital, and the NCDPHA, they're in charge of the medical treatment of the patients.
All right, so Matt, you spoke about the psychosocial aspect of things, or the mental health basically. So your staff have been close to these people. Just as a human being, sitting in a stadium, an indoor stadium by yourself can be a lonely place amongst other people. What are you seeing from patients that have come and gone? Are they psychologically affected by this isolation process?
I think having COVID-19 and being unwell, but also being away from your normal family support can be very difficult for some of our patients. But what we are seeing is that the patients are appreciating the care that's being given to them. There's a lot of people in the TAC, the doctors, nurses, the health workers, the counselors. These people are all going the extra mile to take care of the patients, and the cleaning and the catering staff are all doing that. So our key point is that people are going to recover better if their mental health is being looked after as well. So that's an important part of how we're managing this facility.
All right, so this Tarahumara Aquatic Center, it's been divided into two. One side of the facility has been used for isolation, basically. The other side is used to house this new air lab. Does it come under St. John or a different responsibility?
A different responsibility there. The air lab is being managed, believed by the NCC, and that's being used to increase testing capacity in Papua New Guinea. But the isolation side, as you mentioned, that's a collaboration between the General Hospital, Port Moresby General, and St. John and NCD-PHA.
So most of the patients that you're seeing come to TAC, where are they coming from? From individual swabs in the city or from Port Moresby General Hospital?
We're seeing all sorts of patients. So at the moment, St. John is taking patients from NCD, but we've also had our flying medical teams have retrieved patients from provincial centres. So we've flown the patients by air to get treatment at the Port Moresby General. We've seen patients from Western, we've seen patients from Western Province, from New Island, Goroka, and other places around the country where we've had our flying medical teams go in and get these patients, stabilize them, and bring them back to Port Moresby. They've been maybe treated at the General Hospital and then referred to the TAC for recovery.
Okay, so typically from the start of the swabbing to when they are isolated, how long are you seeing the turnaround time is?
So someone's infectious period is 10 days plus 3 more days without symptoms. So generally, when someone gets COVID-19, they must isolate away from other people for 14 days, because from the 14 days from when they got their symptoms, they could be transmitting the virus to other people. So that's why. Now, if someone's really sick, it can be 20 days or more that they're infectious. That the people that determine the infectious period, that's the NCD-PHA, that's their COVID surveillance team, and they'll determine, along with the doctors that are treating the patient, how long someone needs to isolate. But generally speaking, it's about 14 days as the minimum amount from the day that the patient first felt sick.
All right, so St. John Ambulance is not only operating here in Moresby. There are other places also in the country, like you mentioned in the first segment. Just explain to us the sort of work that they're doing right now.
So we have our ambulances in Lae, in Kundiawa, in Kokopo. We're developing a station at Burena. We have a station at Buruni. So we have around 7 stations, and we operate in 5 provinces at the moment. This is part of the effort of the agreement that we signed with the government in 2019. Prime Minister Marape, the Minister for Health then, and the Secretary for Health signed an agreement with St. John to try to get more ambulances across provincial centres. So they're based in the provincial towns and can respond to the emergencies as they happen in the rural settings, in the rural health centres, and bring the patients to the provincial hospital. And this is going to be the most efficient way that we can deliver good quality pre-hospital care to patients in Papua New Guinea.
Okay. There was a period before last year where provincial governments, including the district governments, came forward trying to, seek some form of clarification from St. John Ambulance and how they can work in partnerships with the organization. Has it sort of slowed down, or what's the situation now with provincial governments actually coming and telling the organization, look, we want the ambulance in our province?
Well, the best care for patients is when it can be delivered by professionally trained people with the right equipment. Sometimes we see ambulances in rural centres that maybe are needing maintenance, or maybe they haven't got the equipment that's needed. What we have in St. John, and what we're pleased to do with the provincial health authorities that we're working with, is make sure that the people working on the ambulances are trained and equipped, because you wouldn't want a fire truck turning up to your house with people on board who'd just been given the keys and shown how to drive the fire truck. You want people that know how to use the cutters, how to use the hoses, how to pump water onto the house, how to use the breathing apparatus to evacuate people from the house, because sometimes when well-intentioned people try to help, it can not be helpful. You wouldn't want someone running into a burning building without knowing how to use the breathing apparatus. And it's the same principle in the ambulance service. We want to make sure that everyone on ambulances is fully trained in how to provide the best care to patients that is possible, and that they carry equipment like resuscitation, like defibrillators, and making sure that they have things like snake bite bandage and this kind of thing, so that we can save lives.
Discussions with Matt Cannon, the CEO of St. John Ambulance. We'll take a short break and come back with more on the other side. You're watching Infocus. Welcome back. Matt, the third wave of COVID-19 here in Papua New Guinea, we're witnessing also the presence of the contagious Delta variant. What are your thoughts of the current surge and the response that's happening right now?
Well, we are seeing a big surge of COVID-19, and this Delta variant now in PNG is wreaking havoc on health facilities, but it's really affecting patients and families. Every day I get on the Facebook and I'm seeing more and more people that are suffering, and people that are expressing their regret for their late family member that's passed away. This is devastating communities. It's causing hurt, it's causing heartache. COVID is really having effect here now, but we have a new weapon against COVID, and that's the vaccine. This weapon, vaccine, it will help save lives. Sadly, all the people that have passed away in PNG so far have been unvaccinated. They haven't had the opportunity to get the vaccine. But the message is clear now, the vaccine is available. NCD-PHA is rolling out the vaccine, as are other provincial health centres. Morro Bay PHA, East New Britain PHA, all of the PHAs are now rolling out their vaccines. There's great vaccines available, and I think it's important that we stress that the vaccines are there. The vaccines are there for you to take. There is misinformation about vaccines. It's important, for example, that women that are pregnant get vaccinated. And Professor Glenn Moeller has come and said very firmly, it is very sad when pregnant women have COVID, because it can be very serious in them. And that's why people, including pregnant women, should be going forward to get vaccinated. And the nurses at these clinics can help you, but the vaccine's there. NCD-PHA already this yesterday administered 1,600 vaccines. And that's great. There's about 80 days to the end of the year. That means we might get to about 140,000 people if we continue this up, maybe 200,000 people in the city vaccinated. But really, we need to strive for 800,000. Nearly the whole population of NCD being vaccinated will be our quick way back to our normal lives, where we don't have to be so concerned about the COVID virus affecting our families or making us very sick. We know that if we're vaccinated, we've got a good degree of protection against getting seriously ill from COVID-19.
Yeah. Well, Matt, people are saying that, some doctors in Papua New Guinea, especially nationals, are saying one thing, the others are saying another thing. It's kind of confusing people at the moment. What is your observation of this?
Well, I think this situation is not unique to PNG. It's happening all around the world. But what we are seeing is the overwhelming majority of doctors, the overwhelming majority of medical specialists, of medical scientists, of nurses are saying, have evaluated and researched vaccine. They're talking the facts. There's no denying that vaccines save lives. The statistics in other countries where they have high number of people vaccinated shows that there's far fewer deaths. If we look at Fiji, they have now got around 90% of their population vaccinated, and they're seeing only something like 20 new cases a day. That's on the back end of Fiji had a very big surge in COVID, but they've managed to get 97% of their eligible population vaccinated, those of the age that can get the vaccine. That's amazing. And that's saving lives in Fiji. And Fiji's on the way back to normal life. They'll be accepting international tourism soon. They'll be opening their borders and allowing tourists to come, which is good for the economy, good for people's livelihoods, and it's great for everyone involved. And that's some of the things that we can be happy about when we can get enough people in the community protected against this COVID-19. But it is important, as you said, there's misinformation. and people need to be looking at medical science, not pseudoscience. And sometimes we see too many expert practitioners of pseudoscience. Let's listen to the real doctors out there. You have fantastic doctors like Dr. Yokapua, Professor Glenn Moller. These people are trusted doctors, and they're saying go and get vaccinated. And for me, that's important. And when I see the National Research Institute, when I see the IMR saying that the vaccine is the way to go, this for me is confidence that it's the right thing to do for me living in Papua New Guinea.
All right. But many are saying, why take the vaccine when it's not a cure?
Well, look, that's a good question. The vaccine, like all vaccines, has a degree of efficacy. The vaccine is your best chance. It's your best chance of being protected. It is associated with a far, far lower chance that you'll end up in hospital if you're vaccinated. And it means that if you are vaccinated, you are protected from serious illness. And that's the most important thing there. You might still get mild symptoms, and I know people that have had the vaccine and they got COVID, they came in contact, someone transmitted COVID to them, they felt a bit sick, but importantly, what they didn't feel is the need to go to hospital. They didn't feel so sick that they needed to go to hospital, and they're alive today. They're very lucky they had their full dose of vaccine, they got a very mild illness, and it protected them. I've been getting the flu vaccine for nearly 20 years. And the flu vaccine doesn't give you 100% immunity to the flu, but it does protect you against most strains. And I've had the flu maybe 2 or 3 times. One time there was swine flu. I got swine flu, okay, before there was a vaccine for it. But because I've had the vaccine, I've been protected against this flu for quite a while. But that's where the vaccines are important. They give you a degree of protection that you wouldn't have otherwise. It's a bit like if you have a headache, you don't need to take Panadol, but you would take Panadol, wouldn't you? Because it's going to reduce your headache. But in this case, the vaccine will help save your life.
Yeah. And the other thing also, Matt, is that when you are in hospital, on oxygen, it's too late to get vaccinated.
Oh, absolutely, yeah. The vaccine takes about 2 weeks to start working fully. So if you're already in hospital and you're on life support, you won't be able to get the vaccine at that point. But if you recover from the life support, then later on you can get the vaccine. But I think it's a very serious point you make there. It's too late when it's too late. When you're already struggling, when you've already got the virus, the vaccine won't help you anymore.
And the scenario is when it's too late, and if you've died of COVID-19, your family members don't get the privilege of according you that final Melanesian love that we've come to know.
Yeah, it's very important to get protected from COVID. Very important.
Matt, look, thank you very much for joining us on the program, and we wish you and the team at St. John Ambulance all the best towards the end of the year, and we hope this pandemic is over and let's all get vaccinated.
Thank you, and same to you.
All right. If you have comments on tonight's program, you can email us on the email now showing on your screen, or you can engage with us on our social media pages. For now, stay safe from all of us here. Bye-bye.